Hello and welcome to Anticlock Academy. I am Dr. Krishan Mohan Kapoor, and in today's video, we are going to explore the key muscles in the upper third of the face that are targeted for botulinum toxin injections. We'll cover the injection anatomy of the Procerus, Corrugator supercilii, Frontalis, and Orbicularis oculi muscles, focusing on how understanding these structures help us achieve optimal results when performing botulinum toxin treatments. In this video, we'll learn about the injection anatomy to ensure the safest, most effective botulinum toxin injections in the upper face. The upper third of the face is primarily responsible for the dynamic movements that create expressions such as surprise, anger, and concern. These muscles, Procerus, Corrugator supercilii, Frontalis, and Orbicularis oculi, are all involved in the creation of wrinkles and expression lines. Botulinum toxin is widely used to relax these muscles, reduce the appearance of wrinkles, and restore a more youthful and refreshed look. Talking about individual muscles, let's talk about Procerus first. The Procerus muscle is located at the bridge of the nose, extending upwards between the eyes. Its origin is from nasal bone and upper part of lateral nasal cartilage, and it inserts in the skin of glabella, fibers of frontal belly of occipital frontalis muscle also. It plays a key role in creating horizontal frown line which forms at the root of the nose when we furrow our brows. The Procerus pulls the skin of the glabella down, causing a horizontal line typically seen in expressions of anger, concentration, or frustration. Botulinum toxin is injected into Procerus to relax the muscle and smooth out the horizontal line. The injection point is typically placed in the midline, just above the nasal root. The botulinum toxin treatment can reduce the intensity of the horizontal frown line and soften the appearance in the glabellar region. The next muscle is Corrugator supercilii. The Corrugator supercilii muscles, they exist as a pair of small pyramidal muscles that lie deep to the frontal part of occipital frontalis as well as the orbicularis oculi muscles. They arise from the medial superior orbital ridge of the frontal bone. From the medial end of the eyebrow, the Corrugator supercilii muscles, they travel laterally and above the orbital rim to become more superficially. Then they insert into dermis of the medial aspect of the eyebrow just above the supraorbital margin. These paired Corrugator supercilii muscles have two heads, a transverse head and an oblique head. It is responsible for pulling the eyebrows downwards and inwards, creating vertical lines between the eyebrows. This muscle is primarily involved in frowning. It pulls the eyebrows together, forming the frown lines that can appear as 11 lines or glabellar lines when the corrugators are overactive. The botulinum toxin injection for Corrugator supercilii is placed directly into the muscles along the medial aspect of the eyebrow. The ideal injection points are located above the orbital rim and medially. It is given lateral to the Procerus injection point. Botox injection in this area, it helps the relaxation of the muscle and reduce the intensity of the frown lines. The goal is to soften the frown without affecting the natural expression. Next is the Frontalis muscle. The Frontalis muscle is the largest muscle in the upper face running across the forehead. Its origin is Galea aponeurotica, or from the fibers of frontal belly of occipital frontalis muscles. This muscle has no bony attachment. Its medial fibers are continuous with those of Procerus. Its intermediate fibers blend with Corrugator and Orbicularis oculi muscle, thus attached to skin of the eyebrows. And its lateral fibers, they are also blended with the Orbicularis oculi muscle over the zygomatic process of frontal bone. This muscle is responsible for raising the eyebrows, which is why we see horizontal lines across the forehead when we express surprise or concern. The Frontalis allows for movement of the eyebrows, specifically raising them, and is responsible for horizontal forehead lines. These lines appear when the forehead is wrinkled, typically when expressing emotions such as surprise, worry, or intense concentration. Botulinum toxin for Frontalis is injected to reduce the appearance of horizontal forehead lines. The injection points are generally placed well above the eyebrow, across the forehead, aiming for a horizontal line to ensure smoothness across the forehead. Care must be taken to avoid over-injecting and causing brow ptosis. So, injections should be placed to achieve a natural lift while avoiding complete muscle relaxation. Next is the Orbicularis oculi muscle. It surrounds the eye and is responsible for actions such as closing the eyelids, blinking, and squinting. The orbital part of Orbicularis oculi is responsible for causing crow's feet lines overlying the orbital rim and originates from the nasal part of frontal bone, frontal process of maxilla, and medial palpebral ligament. These fibers encircle the orbit completely, extending into the soft tissue of the adjacent regions. The orbital part has no bony insertion, but instead it attaches to various soft tissue structures of the periorbital region. The upper fibers merge with occipitofrontalis, corrugator supercilii, and depressor supercilii muscles, finally inserting into the skin and subcutaneous tissues of the eyebrow. The inferior and medial fibers of the orbital part blend with levator labiae superioris, levator labiae lequinesi, zygomaticus minor muscle. This muscle is often a focal point for botulinum toxin injection, especially while addressing crow's feet lines. These are the fine lines that appear at the outer corner of the eyes. The orbicularis oculi muscle contracts when we squint, smile, or blink, causing crow's feet lines to form at the lateral corners of the eyes. This muscle is key in the development of fine lines and wrinkles around the eyes, which can make a person appear older or tired. Botulinum toxin is injected into crow's feet area just at the lateral corners of the eyes, where the orbicularis oculi muscle is most active. The injection points are typically placed just lateral to the eye to relax the muscle and soften the appearance of crow's feet. Now that we have covered the anatomy and functions of these muscles, let's talk about botulinum toxin injections and safety consideration for the upper face. First is the precise injection points. Understanding the precise anatomy of Procerus, Corrugator, Frontalis, and Orbicularis oculi muscles is essential to achieve safe and natural looking results. Second is injection depth. Botulinum toxin should be injected into the muscular plane to ensure efficacy. Injecting in wrong plane can lead to unwanted side effects like brow ptosis or eyelid drooping. Third is dosage. The correct dosage of botulinum toxin for each muscle is crucial to achieve the desired results. Too little toxin will not have the desired effect, while too much can result in over-relaxation of the muscle and unnatural expression changes. Fourth is symmetry and achieving natural results. Botulinum toxin should be injected in a way that maintains a patient's natural expressions. For example, when injecting the Frontalis or Corrugator supercilii, you want to ensure that the eyebrows are raised slightly and that the frown lines are softened without making patient appear frozen or unnatural. To conclude, the upper face is a critical area for botulinum toxin injections, especially for treating wrinkles and the lines caused by Procerus, Corrugator supercilii, Frontalis, and Orbicularis oculi muscles. Understanding the anatomy, function, and injection techniques for these muscles allows for safe, precise, and natural looking results. Botulinum toxin is a powerful tool for facial rejuvenation, but like all injectables, it requires a solid understanding of the anatomy to achieve the best outcomes. Proper injection technique ensures that you can reduce lines and wrinkles while maintaining patient's unique expressions and avoiding complications. Thank you for watching today's video. I hope this quick look at the injection anatomy for the upper face has been helpful to you. Stay tuned for more educational content and don't forget to like, comment, and subscribe for further insights into injectable treatments and facial anatomy.